Hi everyone, today I'll be sharing with you a brief summary of one of the projects that I completed for my PhD, which examined the association between neighborhood socioeconomic status and development of kindergarten children on the autism spectrum. This was conducted as a national study, and we collected data on children with autism all across Canada. There's increasing evidence indicating that population-level inequalities in health outcomes are usually not accounted for by factors that operate at an individual level and may be better explained by factors that operate at a group level, such as neighborhood characteristics. Thus far, our understanding of the relationship between neighborhood socioeconomic status and development of kindergarten children with autism remains poorly understood. With this background, we decided to conduct a national study with the hypothesis that children who live in low neighborhood SES areas are more likely to experience developmental challenges. For this project, we used population-level data sets that were linked together using postal codes. To examine children's developmental health, we used data collected from the Early Development Instrument, or the EDI, which is implemented all across Canada for kindergarten children by their teachers. The EDI collects information on 5 different areas of development, which include physical health and well-being, social competence, emotional maturity, language and cognitive development, as well as communication and general knowledge. In order to examine children's SES data and SES standing of the neighborhoods where they live, we use data collected from the Canadian Census as well as the tax filer data. In terms of the analysis, I'm not going to go into the technical details. However, we essentially looked at the association between neighborhood socioeconomic status and children's development after controlling for a series of individual variables, such as children's individuals' SES, their demographic characteristics, as well as the province of residence and clustering of the neighborhoods where they live. Overall, the findings of our study show that even after controlling for individual level factors, neighborhood socioeconomic status has a significant influence on children's development. Notably, children who live in higher neighborhood SES areas are less likely to experience developmental vulnerability. Now, what does it mean from a policy and service perspective? This highlights the importance of customizing services based on areas of need. For example, based on the findings of our study, we should know that children who live in low SES areas are more likely to experience developmental vulnerability. In this context, if there is a province with a very high proportion of neighborhoods with low SES, this indicates the need for a greater level of services. Therefore, a greater level or a greater volume of early intervention services should be provided in these areas. If we are able to design services based on the findings of this national study, we'll be better positioned to provide services to children in areas where they need them and when they need them to support their healthy development in the future. This brings me to the end of my presentation. Thank you for listening.